Hello, everyone. This is Abel Chih-Hung Lee from Kaohsiung Chang'e Memorial Hospital in Taiwan. Today, I'm going to talk about synchronous teledermatology consultation for people with skin diseases and with psoriasis in particular. There's a shortage of physicians in remote regions. The nationwide physician number per 10,000 population in Taiwan is 21.1. In the capital Taipei, the number doubled of the average at 41.5. However, in several remote regions, for example, in Fongbin County and Chengong Town, in eastern and mountainous Taiwan, the number is only 1 to 4th or 5th of the ordinary numbers. Moreover, in these two regions, the physicians of these three specialties of dermatology, ENT, and ophthalmology are zero. In 2018, the Ministry of Health and Welfare in Taiwan made an amendment to the Physician Act, which stated that in certain conditions, such as health care less privileged regions, the physicians could provide health care without the conventional and legal physical encounter between the patients and the physicians. This paved a way to start the first live and interactive synchronous telemedicine from the main hub Kaohsiung Hospital to serve a community hospital in Taitung. To adopt a synchronous consultation, the hospital needs the health information system with internet service. It also needs coordinators and with diagnostic and therapeutic reply. For the local hospital, it needs to equip with telemedicine equipment for real-time audio and video monitoring and streaming, with optional scope like dermatoscope and ophthalmoscope and ENT scope, with fast and rapid physician control rooming, and with recording automatically. The teledermatology in nature could be categorized into store and forward or live interactive categories. The S&F is not synchronous, but it is convenient. However, the photo accretion may vary, and there's a lack of more medical information other than the photos. The live interactive mode is similar to a physical visit and with synchronized interactions. This live interactive synchronous in teledermatology also provides an opportunity for education for the general practitioners. This is a launch ceremony connecting hospital in Kaohsiung and in Taitung in 2018. The major government healthcare administrative personnel joined the event, along with the acting vice president of Taiwan, Professor C.J. Chen. The successful deployment of the telemedicine services depends on four components. The first important one is a fast and safe data transmission and storage. Pharmaceutical management, like for that in physical visit, is also important for telemedicine. Personnel training includes educational program and workshop for healthcare practitioners. It also includes the introduction to standard operation procedure in telemedicine, with group discussion for telemedicine scenarios. And we also need the hands-on practice from the personnel in the telemedicine. The personal training also including direct doctor-to-doctor connection and coordination practice. The community promotion is also important because many of the patients in the remote regions may not be familiar with the telemedicine in the beginning. Fostering the understanding and adoption of telemedicine is important for a success. For the teledermatology service in Taitung, we reported 1 year experience in the Journal of Formosan Medical Association in January 2021. In the first month, there are only 3 disease diagnoses, including eczema, fungal infection, and scabies. And later on, in the following months, the diagnosis became more diverse, including pediculosis, psoriasis, and urticaria. Patients with severe diseases, including bullous pemphigoid, are present. We also saw patients with psoriasis and hidradenitis suppurativa. The Vice President of Taiwan, Professor C.J. Chen, gave an opening remark about the recognition of our effort in utilizing of teledermatology to serve people in distant regions.
Recent developments in telemedicine have also given dermatologists more opportunities to provide top-flight medical services in remote areas where health services are more limited. Last year, I attended the opening of the first virtual telemedicine service connecting Chih-Hung Memorial Hospital in Kaohsiung and Taidong Hospital. Through advances in AI technology, I'm sure that dermatology can be a big part of this trend toward modern, smart healthcare systems.
Next, I will talk about the telemedicine service in Pescadores Islands or Penghu Islands. Penghu is a military strategically important place in the middle of Taiwan Strait. The main hospital in Penghu is located in Magong, which is highlighted by the patient cluster here. No, eczema is a leading diagnosis, followed by psoriasis. If categorized by the distance to the main hospital in Magong, the patient of psoriasis in the far region tend to use the teledermatology service, even they live far away from the hospital. Shown here are the numbers of each diagnosis in the x-axis, showing that the leading diagnoses are eczema, dermatophytosis, and psoriasis. Interestingly, the patient with psoriasis tend to visit the hospital for the telemedicine service than those with the tinea of eczema or others. Our data is reported in the telemedicine and e-health. Using the teledermatology service, I also solved the mysterious cause of skin rash epidemic by airborne caterpillar dermatitis in Pescadores Islands. In the southernmost part of Taiwan, named Langyao region, is also served by us as a stand for the social responsibility. What is a good telemedicine from a consultation dermatologist's opinion? I think the user-friendly camera control by the consulting dermatologist is important. We also need a real-time history taking and physical examination, including the occupation and environmental exposure. And we need dynamic videos rather than the static photos. The whole process are recorded and should be transformed in the medical record automatically. In summary, synchronous teledermatology provides prompt, accurate, and appropriate health care to people in rural regions. Among the patients with skin diseases, eczema is the leading diagnosis. Psoriasis is the second most disease. However, patients with psoriasis in areas far away from the main hospital tend to utilize the teledermatology service, indicating the desperate medical needs for psoriatic patients living in rural regions. Thanks for your attention.